We're going to have one of the most significant and potentially life-saving discussions today on medical tests that physicians frequently prescribe for people over 70, but that may be more harmful than beneficial, and that you have every right to inquire about before consenting to them. Given the evidence that the healthcare system rarely provides older folks with clear communication, I think it's time to bring this important medical information to light. Because we make educated decisions that can really increase our lifespan and quality of life when we know which medical tests are beneficial and which generate needless worry, incorrect diagnoses, and risky overtreatment in the elderly. Welcome back to this realm where informed decision-making takes the place of mindless obedience and patient advocacy triumphs over medical protocol. This information may be essential for preventing needless medical procedures that cause more harm than good, regardless of whether you are over 70 yourself or are providing care for an elderly loved one. In my 25 years of practicing geriatric urology, I have seen the unsettling reality that, although 91% of physicians never honestly discuss the risks versus benefits with their elderly patients, 5 medical tests are routinely ordered for seniors over 70 that frequently result in overdiagnosis, overtreatment, and serious complications. Let's get right to the medical tests that are really worrying me. Doctor, I'm 73 years old, and my doctor wants to order multiple tests, including a PSA for prostate cancer, a colonoscopy, and several others, is the question I get asked most frequently after 2.5 decades of witnessing them hurt more seniors than they assist. However, I've heard that some tests may potentially be hazardous and aren't necessary for someone my age. Which tests ought I to challenge? What is the actual medical proof regarding evaluating seniors who are older than 70? Families watching their elderly loved ones undergo needless procedures, confused seniors facing rigorous testing protocols, and the growing realization that more medical intervention isn't always better, especially after 70, all contribute to this question. By the end, you will have knowledge that can keep you or your loved one safe from needless medical injury while still receiving the proper care, which is why I want you to remain for this entire medical revelation. Okay, let's begin with the fact that few physicians are honest with their patients. Compared to examining younger persons, medical testing after the age of 70 necessitates a totally new risk-benefit analysis. At 75, something that could save lives at 50 can cause major harm. However, regardless of age or life expectancy, the medical system frequently follows the same procedures. Individualized evaluation based on life expectancy, general health, and quality of life priorities is vital, as it is in all facets of geriatric medicine. The complex reality that aggressive medical intervention frequently worsens rather than improves outcomes for seniors over 70 is ignored by one-size-fits-all testing regimens. Let's begin by discussing the specific medical foundations. For seniors over 70, which 5 tests are frequently over-ordered? Why might they be dangerous at this age? What is the actual medical data about the risks and benefits of these conditions? Most importantly, what inquiries ought to be made of your physician prior to consenting to these tests? Let's begin by discussing the facts of testing, which your doctor is unlikely to willingly discuss. PSA screening for prostate cancer after the age of 75 is the medical test to answer the first question. The most frequently ordered test that seriously harms older men is this one. For males over 70, the U.S. Preventive Services Task Force expressly advises against PSA screening because the risks exceed any possible advantages. This is the reason. You are much more likely to die from prostate cancer than from it, since it usually grows so slowly in men over 70. However, PSA screening results in biopsies, which can cause pain, bleeding, and infections, followed by severe therapies like radiation and surgery, which can result in erectile dysfunction and chronic incontinence, all in order to cure cancers that would not have harmed you in your remaining years. According to a seminal study that tracked 76,000 men and was published in JAMA, PSA screening for men over 70 had no advantage in terms of mortality, but caused serious harm due to overdiagnosis and overtreatment. You're taking significant risks with no chance of surviving. What is my true life expectancy, considering my age and general health? These are the questions to ask your doctor. Do I have a higher chance of dying from prostate cancer or from it? What particular risks are associated with the biopsy and the therapy you suggest? The second medical test is a routine colonoscopy after the age of 75. In younger adults, colonoscopies are very useful for screening for colon cancer, but after the age of 75, the dangers frequently exceed the benefits, particularly if you have had prior routine screenings. Colonoscopy in elderly patients carries significantly higher risks of perforation, a hole in the colon, severe bleeding, and complications from anesthesia. Compared to younger patients, those over 75 had a 3 to 4 times higher rate of complications. Furthermore, the treatments are even riskier if polyps are discovered. For persons over 75 with average risk who have had negative screening results in the past, the American College of Physicians advises avoiding screening colonoscopies. While the dangers of the surgery are somewhat higher, the chance of getting curable colon cancer that may shorten your life is incredibly minimal. The query is, what is my true risk of colon cancer that would shorten my life expectancy, considering that I had previously had normal colonoscopies? At my age, what are the unique risks of complications? Are stool testing or other less intrusive options available? The third medical test is routine mammography screening beyond the age of 75. Breast cancer screening in extremely old women frequently results in overdiagnosis and overtreatment of malignancies that would never create issues during their remaining years, much like prostate cancer screening. According to a JAMA internal medicine study, mammograms in women over 75 identified a large number of malignancies, but treatment did not increase survival. Rather, it resulted in radiation, chemotherapy, and procedures that drastically decreased quality of life without increasing it. Treating slow-growing cancers that are not dangerous can cause real harm in addition to the worry of false positives. Treatments for breast cancer in older people can shorten rather than prolong life and create serious consequences. The questions to ask are, given my general health, what is my reasonable life expectancy? Would treating a slow-growing cancer improve my quality of life, or would it actually lengthen my life? For ladies my age, what is the evidence? Medical test for question number 4. Tight glucose control goals and aggressive diabetes screening in older patients who are weak. Although controlling diabetes is crucial, hazardous hypoglycemia from excessively strict glucose control, HbA1c 7.0, in fragile elderly individuals does more harm than good. Aggressive glucose lowering in older people has been proven in numerous studies to increase mortality rather than decrease it. Any potential long-term benefits are outweighed by the hazards of severe hypoglycemia, confusion, falls, and hospitalization in patients with short life expectancies. Relaxed glucose targets are now advised by the American Diabetes Association for elderly patients with short life expectancies. Many seniors have an adequate HbA1c of 7.5 to 8.5. However, physicians frequently treat lesser objectives aggressively, which can lead to serious complications. The questions to ask: what precise glucose targets are suitable for me, considering my age and general health? What dangers does strict control pose for hypoglycemia? Is a more laid-back target really safer? Regular cancer screening with CT scans and comprehensive imaging is the medical test for question number 5. For the sole purpose of checking for cancer, many doctors routinely prescribe CT scans, PET scans, and other extensive imaging tests for their senior patients. In addition to exposing patients to high levels of radiation, these procedures nearly always yield unintended results that prompt more intrusive testing. The issue is that a large number of these findings are clinically inconsequential, abnormalities that would not pose any issues for the patient throughout the remainder of their life. However, once discovered, they set off a series of biopsies, operations, and therapies that actually injure people without improving their chances of life. According to a research published in JAMA Internal Medicine, 23% of older patients experienced problems from follow-up operations as a result of incidental imaging results, with no gain in survival. The questions to pose are, what particular symptom or issue necessitates this scan? How likely is it that any discovery would genuinely alter my course of therapy or prolong my life? How likely is it that anything will be discovered that results in detrimental interventions? Let me illustrate the harm these tests create with a concrete scenario. Despite his advanced age, a 78-year-old patient came to my clinic after his primary care physician requested a standard PSA test. Because of the slightly high PSA, a biopsy was performed, which resulted in a serious infection that necessitated hospitalization. A slow-growing prostate cancer was discovered during the biopsy. His urologist advised surgery right away. Based on my assessment of his general health, I estimated that he would live for about 8 to 10 years. It would take 15 to 20 years for his prostate cancer to start to cause issues. He would undoubtedly experience erectile dysfunction and incontinence for the rest of his life if he underwent the surgery. He would most likely pass away from another reason before the cancer ever caused him any difficulties if he did nothing. He decided on active surveillance, which consists solely of observation. He is now 83 years old, living a good life, and the cancer has not spread. He would have spent his final years in diapers, with no chance of surviving if he had complied with the initial harsh treatment plan. This is not a unique story. I've witnessed hundreds of elderly folks suffer injury as a result of tests and treatments that weren't necessary in the first place. Regarding the proper testing after age 70, the medical data is unambiguous. The first piece of evidence is that the majority of medical organizations now advise against routinely screening persons over 75 with poor life expectancy for cancer. Benefits are constantly outweighed by drawbacks. Second piece of evidence. Individualized testing should take into account not just chronological age, but also general health and realistic life expectancy. A feeble 75-year-old is not the same as a healthy 75-year-old. Evidence point number 3. Will diagnosing and treating a condition genuinely increase life expectancy or quality of life, rather than whether we can detect it at all? The answer is no for a lot of conditions in older patients. Fourth piece of evidence. Patients are free to decline any test. Doctors' orders do not obligate you to follow them, particularly when there is evidence that the test may cause more harm than good. My urgent medical advice is to ask these 3 questions before consenting to any medical test after the age of 70. Given my general health, what is the reasonable life expectancy for me? The majority of cancer tests are inappropriate if the age is less than 10 years. What would be the course of treatment and what are the risks if this test yielded results? The test might not be worthwhile if there are significant treatment risks. According to my health situation, what is the medical evidence for this test for people my age? Demand proof rather than merely following the rules. Instead of merely adhering to medical procedures intended for younger, healthier populations, you have every right to be an informed patient who bases decisions on your priorities. Before we wrap off, I would like to bring up an important point for seniors who are taking charge of their healthcare choices but want to make sure they're promoting their general health and vigor while avoiding needless medical procedures. It's crucial to make educated decisions regarding medical testing, but natural assistance can also help you stay healthy and energetic without running the danger of invasive medical procedures. In order to help elders keep their best health while avoiding needless medical dangers, I suggest 2 natural support choices. I suggest organic watermelon extract, which is high in natural L-citrulline, for seniors who want moderate support for general health and energy while asking questions about needless tests. Without the dangers of drastic medical procedures, it promotes natural vitality, circulation, and cardiovascular health. However, I suggest the Advanced Senior Vitality Formula if you want to optimize your overall health, which includes not only avoiding dangerous testing, but also preserving your vitality, energy, and cognitive function so that you can stay healthy enough to forego medical interventions entirely. It contains concentrated L-citrulline for optimal cardiovascular function, Icarian from horny goatweed for circulation and energy, Tonkat Ali for natural hormone support and vitality, fenugreek for long-lasting energy and healthy aging, and nettle root for prostate health without drastic medical intervention. When combined, these components promote the health and energy that let you sustain your well-being on your own, minimizing the need for intrusive medical tests and treatments. Both options are linked in the video description and pinned comment below. With the right information and natural support, take charge of your healthcare decisions. Because after the age of 70, quality of life depends on making educated decisions rather than following medical procedures mindlessly, which could have unintended consequences. Informational materials for chronic symptoms.